Hello everyone, my name is Thomas Carr and I am here on behalf of the Manchester Men Speak Up online forum. Today I'm delighted to be joined by the Mayor of Greater Manchester, Andy Burnham. How are you today, Andy?
I'm good, Tom. I'm good. It's great to speak to you.
Thank you for being here. I really appreciate your time. So the reason for this interview is we wanted to speak with leading figures in our city about what concerns them when it comes to health and care in Manchester and Manchester citizens. So first of all, to start off with, towns in Greater Manchester have an average life expectancy for men that is among the lowest in the country. Among the towns in Greater Manchester, there is a link between where you live and your life expectancy. So we know that men who live in Manchester and Rochdale often live shorter lives than men who live in Trafford and Stockport. That being said, what steps do you think we need to take to level up health, life expectancy, and well-being for people across Greater Manchester, specifically men?
Well, you're absolutely right with your analysis. The gap overall between Greater Manchester and the rest of the country is too big. But even within our own city region, there's a north-south divide, and we need to do something about it. I think there's so many reasons behind it, aren't there? That underlie it. Housing is a massive thing. The kind of standard of housing, the availability of affordable housing is a huge. Housing creates good health, and too many, of our kind of fellow residents are living without good, secure housing because it's both a physical health issue in terms of housing, but it's a mental health issue as well, isn't it? In terms of you don't feel you're in a secure arrangement. From there, you've got obviously issues around work and the quality of people's work and the life chances people have to progress within work as well. So all of it is in play, Tom, as far as I'm concerned. The good news is, to the extent that there is some good news, devolution of power to Greater Manchester has begun to change things because there was a study in the Lancet a couple of years ago which showed that in the first kind of 5 years of Greater Manchester devolution, particularly when we had a degree of health devolution, we we increased life expectancy faster than expected. And that was particularly marked in our more deprived communities. And I think that was linked to some of the work we were doing around homelessness, because obviously, if you kind of have a situation as we did have, if you go back a decade ago, where too many people were dying on the streets. I'm not saying that still doesn't happen, but we did quite a lot to give homes to people who were in that position of being an entrenched rough sleeper. And I think that started to do something in terms of life expect, so, but there were other reasons as well. I just think where we're going into now as Greater Manchester in the next decade, 25 to 2035, I think we've just got a lot clearer about what we need to do to put the foundations beneath everybody so they can have a good, healthy life. So we're talking about being a housing first city region, intervening in housing in a much more meaningful way, releasing Greater Manchester from the grip of the housing crisis. And what does that mean in practical terms? It means building more social homes than we are losing. We're still losing more than we're building. We've got to get to a tipping point where we're building more than we're losing, and do that quickly. It is about the connection that comes from a better transport system. So the B network hopefully, helps people connect to opportunity and to each other. And it's a healthier city region has a transport system of that kind. And then it's then from all of those foundations starting to move towards better employment for people, better life chances for our young people. I'm absolutely committed to building an equal alternative to the university route for young men in Greater Manchester, and young women, but particularly recognising that there are some who've been very poorly served by the education system, a system that's obsessed on the university route and not done enough to think about the life chances of those who want something different. So all of those ingredients are in the mix. And, I think in the next decade, we can do more to close the gap between Greater Manchester and the rest of the country than perhaps we've ever been able to do before.
That's really exciting news to hear. I'm glad you feel the same way many people in Manchester do as well. Whilst you were Health Secretary in 2009, I was doing a bit of research about this and I found that you launched the Ahead of the Game Organise Your Defence pilot scheme to educate men about lung, bowel, and prostate cancer. And now, given the recent increase in coverage on cancer in men, we know in the news recently, prostate cancer has become the number one killer of men, or one of the highest killers of men, and the most frequent cancers in men. Is this something you'd be interested in doing again, or see a scheme similar to this now that you've become the mayor of Greater Manchester?
Definitely. You've taken me right back there. I was quite proud actually to, bring that through at the time because it created a lot more focus on prostate cancer than it had before, and I was very proud of that. But I think there is more we can do there, but also in terms of men's mental health. I think that's a massive issue, and it needs more focus. In my early days as mayor, I was asked by my health colleagues here as to whether or not we were prepared to have quite a bold campaign around suicide prevention. And at the time, no one else was talking about it in quite as direct terms as we did. But the Shining a Light on Suicide campaign has been running now for quite a number of years. And again, we did something quite innovative in forming a partnership with the League Managers Association, who got leading voices from the game to speak about the management of men's mental health, particularly within a football club environment, and understanding how we need to work to support each other's mental health every day. I'm a big believer in some of the innovations we've seen around Andy's Man Club, but there are other versions of that as well across the city region. And I think, for me, I would work, alongside initiatives around cancer, obviously, and other heart disease and exercise. But I do think, the issue of our time is men's mental health. And, I think there is more for us to do together in that space.
I think there's so much scope for art these days in terms of how much sport is covered, how much access you have to it. So things like darts, rugby, football, but really good to partner with organisations in those spheres and get men's mental health spoken about more and hopefully reduce the numbers of male suicide there is in society.
I think it is the biggest killer, unfortunately. It's a terrible thing to say, but it's true. And we just wish it wasn't like that. But sadly, suicide, I think, is the biggest killer of men. Certainly, men under I think under 50. And that's something we've all got to really face up to and work together on. And I do think some of the I went to there's a project launched in Cadishead, Earlham area. We lost one of our firefighters in Greater Manchester to suicide, and in his memory, a support group was set up, and I went down to watch one of the sessions, and it had a profound effect on me, to be honest, to see lads walking in from all walks of life and sit down and sort of open up with each other, and in a way that they wouldn't do with their families, they wouldn't do probably with professionals. It was really something. I was really taken by it, and I think that's Greater Manchester at its best, really, isn't it? Where we support each other in those type of settings. We empower communities to help themselves, and I think there's a lot more we could do there, Tom.
And it's so important to talk about this topic now, obviously, with suicide and mental health being such a issue in modern society. It's great that people are talking about it compared to 30 years ago, where it was barely spoken about at all, and we're seeing a stigma to it.
Cause obviously I was a member of Parliament before becoming Mayor of Greater Manchester, and I remember being in Parliament for a debate, I think it was around 2015, where for the first time ever, two male MPs admitted having had mental health problems. Now, there was a period in politics where nobody would have done that, for fear of what that might mean in terms of standing in the kind of with the electorate, etc., and what people would do to use that against you, and it was such a breakthrough moment, that I think, when in Parliament, the place that people should look to lead the national debate, where people started to speak in that way. And I do look at the decade since then, where mental health has become a much more open conversation, and that's a really positive thing. However, I think in the same decade, the pressures have increased on people, and men in particular, around the pressures of cost of living, of work, of all manner of pressure. And So but while the openness is great, the challenge has probably even got bigger, and
Yeah,
hence the need to do much more.
absolutely. I completely agree with you, Andy. Okay, moving on to a further question. So the Secretary of State, Wes Streeting, has confirmed plans recently to introduce a men's health strategy, which aims to address the bigger issues affecting men of all ages in the UK. What would you say, or how would you do you think this needs to be translated into action for men in Greater Manchester?
I think it's a really good thing that we're getting a focus on men's health at the national level, because I think there are some specific things that are needed, as we've just been discussing, that could be put in place without a sort of massive bill at the end of it. And I think it's this thing, isn't it, that men are probably less likely to talk about their health, aren't they,
Mm.
in an ordinary kind of situation. Men are more likely to just carry on with something, even though they may have an issue that they should have checked out. They're more likely just to sort of battle on and not say anything about it. And so, we really do need to open up on these issues. And from my point of view, I think we've got to, get into a sort of a conversation, not so much about, not a judgmental sort of conversation with people about their health, or a finger pointing sort of approach, because, I was in the Department of Health, as you said, many years ago, and the danger sometimes is that public health campaigns can appear judgmental or finger wagging or don't do this. And, the bottom line is, I think you kind of need to turn that around and, come at things a different way. We're all guilty to one extent of another, not eating brilliantly, drinking too much, you name it. We're that those temptations are that kind of there for all of us. I think what you've got to do, and what we potentially can lead the way on, is take a more empowering approach, what we call a live well approach. And this is going to be a big theme in Greater Manchester going forward. What are the kind of simple, everyday interventions we can make to empower people to take more control of their own situation and their own health? And it is around the kind of support I was talking about before, but it's also, exercise referral, isn't it? Just getting people in that position where they're starting to act themselves to deal with help. And if it's something like debt or finance that's the thing that's dragging them down, that we have a easy referral to the necessary support for people. So Live Well is going to become what I call it's a structured everyday support system for people, to empower them to unlock the thing that may be dragging their health down, particularly their mental health down. And we believe we can become the first part of the country to adopt this truly preventative approach to everyday health. And I think we have to think about it in that way. I personally don't think you can treat your way to a better country, in a healthier country. We're hearing the news that the government are going to put more money into expanding GP practices, constantly trying to work to increase access to GPs. Don't get me wrong, that's important, but that can't be the only way to better health. You've got to act more upstream than that, in terms of, as I said, housing support, debt advice, help with addiction, and improving people's workplaces, improving people's cost of living situation. All of these things, I think, are in the mix, and Live Well is attempting to be a coherent answer to all of that.
I think there's so many individual problems people face, and it's good that something like Live Well is out there to sort of get all those in one place and deal with it for people and support people where they need it. Like you're saying, in terms of housing or debt, or even things like smoking cessation or healthy diets, lack of exercise, that kind of thing.
What my aim is, Tom, is to give people the same sort of instant access to that type of support as they can get a prescription for something.
Yeah.
Because sometimes, we give people instant access to things that may keep them not in the right place. They manage them in the wrong place, if you like. I'm not saying there's not a role for antidepressants, but I would argue that we are over prescribing them, and that has the effect of people sort of being on them and then not moving forward. And I think what we got to get better is giving different types of intervention and support as instantly as medication. So access to all of the things we've discussed, in every community, every day for people who want it. And that's the aim of Live Well. That's what we're trying to get towards. For instance, if you ring your GP at 8 a.m. in the morning and there's the usual rush, and the receptionist should be able to say, look, I can't give you a GP appointment today, but I can get you a Live Well appointment today. That type of, because sometimes, I think you'll know this, and I feel this sometimes. I think we all have a moment where we think, do you know what? I just feel like I need to act on my health and, need to do something to break the cycle I'm in or the rut that I'm in. And sometimes that can be quite a momentary feeling. And if you don't take that opportunity when you're feeling it and when you're ready, then you can slip back, can't you? And I think that's what we've got to try and get to with Live Well.
The services have to be there for people, don't they? Like you say, be accessible as much in, well,
Yeah.
hopefully more than a GP appointment is accessible at this point, but be there for
Yeah.
people who need them. And that kind of links onto my, sorry, were you going to say something, Andy?
No, I was just saying something as well about the quality of people's employment as well, and how employers are geared up to recognise some of these things and work with their employees. So we have a Greater Manchester Good Employment Charter, and we really need to drive more of our employers to sign up so that we get that understanding about men's health more baked in. More access to sick pay. Too many men in Greater Manchester don't have immediate access to sick pay, which is not a good state of affairs. So I think what I would say is you've got to act on every single level here to make the difference.
It's a big challenge, but it's something that we've got to work our hardest to do. And I'm sure everybody in Manchester will be doing that. It kind of links onto my next question, really, what we've just been discussing. But as co-chair of NHS Greater Manchester, what are your key messages to men in our city when it comes to their health and care? Was it things like make sure you're getting your checks, make sure you're talking to people, make sure you're accessing the services you need to access?
Well, I certainly agree with all of the things that you've just said there, Tom. I did make that point before, didn't I, about we are sometimes less likely to come forward and take up those things. But, I would absolutely, and I include myself in this, I'm not the best, if I'm honest with you, sometimes in, getting to the GP if, I kind of, like others, I'm sure, have a kind of tendency sometimes, that will go away and I'll come back to that another day. But I think the key is you've got to take care of yourselves, because you can't take care of anybody else in your life if you don't take care of yourself. And we all have people who need us to take care of ourselves, don't we? Who depend on us for different things, and I think of others in your life really as well, and that should be an incentive, shouldn't it, to go out there and get the help that you need. And if we're going to be the place that I want Greater Manchester to be, where in the next decade, I think we've got a really exciting decade ahead of us, to be honest. There was a time when I came back here in the early 90s after I'd been at university. I wanted to stay here, but like many people of that era born in the late 60s, early 70s, I concluded that to get on in life I had to go south, and there was nothing here to support what I wanted to do. We're not in that place anymore, and that's the thing I would say to everybody. There's so many more opportunities out there now in terms of helping people to access good jobs and get a good life as a result of that. And I would definitely say we're going to need people to look after their health, but also then get better at supporting them to take those opportunities in the growing Greater Manchester economy. There was a time when the lack of jobs and the lack of opportunity really did drag people's health right down, and we don't need to be in that position anymore. This place can be everything we want it to be if men of all ages across the city region are both looking after themselves and then moving themselves forward towards the good jobs and opportunities that we've got. We don't have to talk ourselves down in any way, shape, or form. In fact, we're the opposite. We're the place that a lot of people are looking to, and it could be a really exciting time here. I think it increasingly is becoming a really exciting time in Greater Manchester, but that can bring lots of benefits for people's health, well-being, quality of life, and give benefits to people here that people in other parts of the country have had for many decades before us.
Is there anything else you'd like to discuss with Health Watch Manchester, Manchester Men Speak Up today? I know I was reading your note in the Integrated Care Partnership bulletin that went out last week, and you mentioned that there is a adult ADHD consultation going ahead at the moment. Could you talk on that perhaps a little bit?
Yeah, we're really conscious that we've got to deal with the full range of things that are there and need to be acknowledged and need extra support. So also talking openly about neurodivergence and the different issues that presents. I really applaud you and all of your colleagues linked to Manchester Men Speak Up, because I think this is the culture change that we need, really, to start to talk ourselves about our own health and be open about health conditions. We need that open conversation, and we need to build a culture of empowering people to, if you like, not just sort of feel like they're sort of unable to move themselves to where they want to be, but by being open, by talking, we deal with the challenges that we've got. We don't let something like ADHD or autism hold anybody back. It shouldn't do in this day and age, and I think that's a really important message. Really getting over that. We can support everybody to be everything that they want to be, and we're lucky to live in a city region that thinks like that. Puts in place that support, and I really applaud this initiative, and why I was really keen to come on tonight and to support you.
I think you've absolutely hit the nail on the head there when it comes to making sure people are talking to each other, not suffering in silence. Ultimately, that's the theme of it, really. And
we're a place that looks out for each other, aren't we? That's the kind of way that Greater Manchester has always been. Is what we all love about it. No one here walks on by on the other side, do they? We all want everyone to get on in life and be successful, but those who do become successful are not the kind of people who say, "Oh, well, I'll pull up the ladder now." And we don't like that. We will always look out for each other, and I think that's what makes this the best place to live on earth. I don't think you find better people than you find here. And I just think in the way that society's changed, I think we need to do more of that, more looking out for each other, more pulling each other up. And I think that can make all the difference. I mentioned the shining light on suicide thing before. On that website, there's a simple training course everyone can take, which is about being able to talk to somebody who is expressing suicidal thoughts, or how to notice if people are moving into that category. We should just all do it, shouldn't we? We all take a few minutes of each other's time to do it. We all should learn CPR. I don't know if that's as widely done as it should be, but it should be, because it fits with who we are. Because any of us could find ourselves in that situation. I was in Manchester City Centre once. It was just before the pandemic, and for the first time, used a defibrillator. Somebody was doing the CPR, and I got the defibrillator, and that was an experience that really, really lives with me, because a bit of knowledge there that I had about defibs and where to find one and how to use one made a massive difference. Well, it saved somebody, and I think we've got to move beyond the world of thinking the NHS solves everything, because it can't do by definition, can it? You can't get an ambulance to every person in that position within the time that they're in. So it says we've got to become more self-reliant or supportive of each other, and do what we can to put ourselves in a position of knowledge to support someone else's health, or someone else in a life-threatening situation. So open conversations like the ones that you're stimulating are absolutely the things that we need to be doing. So I think it's a great thing that you're trying to bring about. So yeah, but I think that's the message from me, really. We can all do more to take more control of our own health, but also become more knowledgeable about what would help somebody if we do need to cross that street to help somebody in need. What is it that little bit of knowledge we need to make the difference.
Absolutely. Fantastic. Thank you very much for joining me today, Andy. I really appreciate your time chatting
You're
with
welcome, Tom.
talking, answering my questions. I really appreciate it.
Thank you to Andy and his team for helping to put this interview together. We hope you enjoyed it. For more interviews like this, please head over to the Manchester Men Speak Up website. The link to our website is available in the description of this video. Otherwise, Google manchestermenspeakup.org.uk.